Hi everyone, and welcome to Newfoundland and Labrador's training series about stepped care. My name is Megan Churchill and I'm the Provincial e-mental health manager with the Department of Health and Community Services. I'm a social worker and I've been involved in the development of stepped care for the last several years. I'm glad to be joined by Alison Winter, and Alison, I'll let you introduce yourself.
Hello, my name is Alison Winter. I'm the Regional Program Coordinator with Eastern Health's Mental Health and Addictions Program in the Community Division. I'm also a social worker and have been working with the Department of Health and Community Services to support stepped care implementation for the last year.
The purpose of this presentation today is to provide an introduction to stepped care in Newfoundland and Labrador. It's been a journey, one that began with a demonstration project supported by the Mental Health Commission of Canada and then was later adapted for the entire province.
This presentation is divided into two sections. In the first section, we will briefly describe the origin and evolution of stepped care. In section 2, we will share Newfoundland and Labrador's stepped care model, outline 3 points of access for service, and describe the standardized triage process. While remaining true to stepped care's values and principles, our model has been adapted to suit the specific needs of our people and communities in Newfoundland and Labrador. Since 2015, there have been a series of significant opportunities and events marking the evolution of stepped care in our province. In 2015, the All-Party Committee on Mental Health and Addictions was established and began a review of the mental health care system. There was also funding received to test stepped care among post-secondary students. The All-Party Committee completed its review in 2017, and the Towards Recovery Action Plan was publicly released.
In 2017, the Government of Newfoundland and Labrador and Dr. Peter Cornish co-led the Mental Health Commission of Canada e-mental health demonstration project for stepped care. In 2019, a CIHR grant was received to continue stepped care research between Nova Scotia and Newfoundland and Labrador. By 2020, the stepped care model was finalized. As you can see from this slide, over the past 5 years, there's been a significant effort to engage people and families with lived experience, healthcare professionals, primary healthcare providers, and community partners across the province in the ongoing development and implementation of stepped care. Taken together, Newfoundland and Labrador's current stepped care model has evolved to meet the needs of our system, our people, and our communities. It aims to provide the right service in the right place at the right time by the right person.
Here is Newfoundland and Labrador's stepped care model. Presented as a circle, our model aims to articulate the experience of an individual surrounded by care providers, accessing services throughout the mental health and addictions continuum of care. We recognize individuals may be accessing services from more than one step at a time, and this is more easily depicted by a circle. Shortly, we will describe Newfoundland and Labrador's stepped care model. The key takeaways for this section include the concept of the circle of care, the categories of or types of services available, and the ways in which people can access them.
Early feedback from individuals with lived and living experience in our province noted that the use of traditional staircase stepped care models might contribute to stigma, particularly for individuals using intensive specialized services, linking the higher level steps with being most unwell and using the most resources. Furthermore, individuals did not see how they could step down or visualize themselves in recovery in the traditional staircase models. The Circle of Care was created in response to this feedback and aims to show the collaborative practice needed among all service providers and systems, both formal and informal, to support an individual's recovery journey. Everyone's personal journey of wellness and recovery is unique, and as such, there's no right or wrong path. A circular concept is used to represent a holistic approach to health and to establish wraparound services for an individual at any point in their care journey. The individual is truly at the center of the circle.
The categories represented within the circle of care are meant to show a natural flow from the least intensive and population-based supports to the most intensive and specialized programming. Through key access points, individuals will be screened and supported by mental health professionals who will assist them in using the stepped care model as a guide to offer supports and service. Individuals might naturally start with the least intensive wellness-based supports first, but could start anywhere on the model based on their identified needs, preferences, readiness to engage in service, and clinical indication. While individuals can enter the system at any step in the model, inpatient and specialized services must be clinically indicated based on consultation and discussion between the mental health service provider and the individual seeking service, and an assessment of the individual's needs will be required. For example, an individual may wish to access inpatient treatment services, but before doing so, clinical assessment will be required to determine that the individual's needs based on a number of different factors. Finally, the inner circle surrounding the individual represents partners in care, those who assist individuals in meeting their wellness goals. Partners could include, but are not limited to, primary healthcare providers such as a family physician or a nurse, family and friends, peers, elders, community leaders, the Provincial Mental Health and Addiction System Navigator, and other healthcare providers.
It is important to know that all jurisdictions implementing a stepped care approach aim to adapt their model to ensure the system and services are tailored to the people and communities they are serving, just as we have done for our entire province. Our model incorporates the principles and values of stepped care overall, but it is depicted in a way that is more meaningful to our people and our communities. Now we will take you through each category of service, starting with wellness-based self-help. In the wellness-based self-help care options, individuals are empowered to self-manage their own mental health and wellness by exploring available resources and programs. This might include healthy eating, sports and recreation, healthy sleep hygiene, mindfulness, social connections, books, workshops, online services, and self-help programs. The e-mental health options included in this category are available 24/7 on the Bridge the Gap website. Some examples of e-mental health options that fall into this category could be visiting Bridge the Gap in itself and reading some information about mental health topics in the Knowledge Center, or using the Get Inspired section or the Toolbox section on the website to find strategies for coping with a variety of issues. Other examples could also include signing up for therapy assistance online, or Mindwell U, or Strongest Families, or even the Breathing Room. These services offer meaningful, evidence-based, effective strategies to cope with a variety of issues such as anxiety, stress, depression, substance use, just to name a few. Newfoundlanders and Labradorians can sign up for these programs free of charge and work through the content at their own pace. They can also utilize these programs on their own while accessing other more intensive steps in the stepped care model. In the next category, individuals are connected with community support programs and peer-led services such as LifeWise, Kids Help Phone, AA, NA, and U-Turn, just to name a couple. These supports can range in intensity and involvement and can be used throughout one's wellness plan. As with wellness-based self-help, individuals can often utilize peer and community-led supports as an adjunct on to other more intensive services. The coach or counselor assisted services category includes interventions with a blended approach, such as self-directed work paired with a coach or counselor. For example, Strongest Families offers a blended model, as does therapy assistance online with a counselor. Coach or counselor assisted services often blend the online psychoeducation material with brief focused connections with a trained mental health professional who will work with the individual on an application of a variety of skills to improve mental health and wellness. Connections with a clinician most often take place by phone or virtually. However, in-person services are available for some of these services.
The next category is individual, families, couples, and group therapy with a mental health service provider. We have a variety of healthcare professionals offering high-quality services on our mental health care and our mental health and addictions teams throughout the province. These include recreational therapists, child and youth care workers, occupational therapists, psychiatric nurses, social workers, psychologists, and psychiatrists. There are many primary mental health and addictions teams located in all regional health authorities that offer service through a variety of service modalities and methods. Counseling services can also be accessed through Doorways and is available at sites in each of our regional health authorities, as well as many schools and correctional facilities. Doorways provides rapid access to mental health and addictions counseling services, one session at a time. Individuals can attend Doorways as many times as they would like, and they have the option to see the same counselor more than once. Therapy from this step can be received in a variety of different ways, such as in person, over the phone, or through video conference. Counselors can work collaboratively with individuals to connect them with other steps within the step care model when desired. It's important to note that these community counseling clinics and Doorways are not emergency services. The specialized services category includes intensive interventions to support individuals with complex needs. Some programs accept self-referrals, while others will require a referral from a service provider. Some examples of specialized services include our ACT and FACT teams, assertive community treatment teams, or flexible assertive community treatment teams, which provide treatment of illness and symptoms hands-on assistance with daily living activities, and recovery support for individuals, usually over the age of 18, with serious mental illness and concurrent disorders in our province. Other examples include the opioid dependence treatment hubs, which provide rapid access to medication-assisted treatment such as Suboxone and Methadone, as well as the HOPE program, which offers an intensive outpatient program for individuals 15 plus across the province who are diagnosed with anorexia, bulimia, or other feeding and eating disorders. This category is inpatient services. These include live-in treatment centers and in-hospital care. The majority of these services are accessed following an assessment by a healthcare professional and include places such as the Tuckamore Treatment Center, the Hope Valley Treatment Center, Humberwood Addiction Center, the Grace Center, and the Waterford Hospital, just to name a few. Effective May 2nd, services traditionally offered through the Provincial Mental Health Crisis Line will now be provided by the 811 Health Line. Individuals in need of a crisis response or mental health and addiction support can simply dial 811 day or night to speak with a registered nurse who is a trained crisis intervener. Individuals can also access emergency and crisis services by connecting with things such as 911, Calling Kids Help Phone, Sexual Assault Crisis Line, and the Crisis Text Line. Emergency rooms at healthcare facilities across the province can also help in a mental health emergency.
In developing our stepped care model, we quickly realized that while the services within the steps are vital, the need for easy and consistent access to them is equally, or maybe even more important. While in some areas, finding the right service is easier than others, there is an overall lack of awareness about available programs and services and how to access them. In many cases, people have difficulty finding the right office or provider and are often sent to various places before finding the right one. Stepped care will significantly improve this by providing the right service in the right place at the right time by the right person. In developing our stepped care model, we knew it was important for people to have the information they need to make good decisions about their mental health and wellness, which involves supporting mental health literacy. This can be accomplished in a variety of ways, including conversations with healthcare and service providers, and also by accessing information available online through bridgethegap.ca. For individuals seeking support, conversations to collaboratively determine next steps are based on their primary concern as well as their level of readiness to engage in services. The best results tend to come when people are supported at the point of need and engage with something they feel they can be successful at, rather than assuming a person requires a certain type of treatment based on the severity of their symptoms. It's important to remind you that individuals may start at different steps in the stepped care model and can access multiple steps at one time. For example, an individual can be connected to an individual counselor or group and complete self-help resources online in between their appointments as an adjunct to therapy. Likewise, an individual could be connected to a service within a community agency and attend specialized service appointments. There are many options available that are tailored to each individual's needs. The stepped care model includes 3 access points to the mental health and addiction system: Bridge the Gap, Doorways, and 811. The goal of these access points is to provide choice in the type and modality of service, be easily promoted and remembered, and provide rapid access with clear and consistent processes at each access point. The first access point is online at bridgethegap.ca. Bridge the Gap is the storefront for mental health and addiction services in Newfoundland and Labrador. It's the go-to website for mental health information and connection to local supports and services. Individuals can sign up for online programming, use tools, learn about services in their region, and share stories of recovery with others. Individuals have direct access to these programs without having to do an assessment. There are currently over 15 e-mental health options available here, including self-directed information and activities, crisis intervention, peer support, and coach or counselor assisted programs. Uptake and usage of these services have grown exponentially over the last couple of years. We are currently working on enhancing Bridge the Gap and are in the process of developing a virtual assistant. This virtual assistant will ask questions to help individuals navigate the site and highlight information and programs that might be of benefit to the individual. In the near future, Bridge the Gap will also allow individuals to submit their information to complete a triage process and be referred for other services in the stepped care model.
The next access point is Doorways, which provides rapid access to mental health and addiction services one session at a time. Services are available by phone, in person, or through video conference. Doorways works with individuals to meet their needs, whether that be a single session triage or intake for other mental health and addiction services, or multiple session counseling accessed on an as-needed basis. When someone attends Doorways, they use a standardized form to provide focus and background for the session. If additional high-intensity services are needed, Doorways clinicians can complete the triage for mental health and addiction services so that in most cases, people will not need to be referred on for further intake. The clinician will work collaboratively with the individual and make referrals on their behalf or assist them in accessing other community services that best fit their circumstance. The third access point is a phone call to the Newfoundland and Labrador 811 helpline. Registered nurses with the Newfoundland and Labrador helpline currently provide information about services and mental health topics. They will help connect individuals with services in the community or online programs that can be used anytime, anywhere. Healthline nurses may also provide a callback and provide a wellness check after initial call to 811. The 811 helpline is also a provincial telephone option for mental health and addictions triage. If someone needs mental health and addiction support, they can call 811 and a registered nurse will complete the same triage form used at Doorways or by intake clinicians in the regional health authorities. They will use the information gathered and their expertise to determine which program or services from the stepped care model are most appropriate for the individual calling. They will be able to send referrals to the mental health and addictions teams in the regional health authorities for higher intensity interventions, such as individual counseling or specialized services in groups. And RHA staff will then follow up with the individual within 72 hours. 811 can also refer directly into lower level steps in the stepped care model, such as the strongest families. As mentioned, individuals could also call 811 if they or someone they love are in a crisis and need support. As mentioned earlier, in parallel with the development of stepped care, work was also underway to simplify the process to allow individuals easier access to the provincial mental health and addiction services. This includes the development of a new referral form and triage process and represents a significant yet simplified change from previous referral processes, which collected extensive information. With consultation from many stakeholders and people with lived and living experience, the updated process and form aims to ask only what's needed to determine the best service for an individual. The goal is to ensure people do not need to visit multiple doors and repeat their stories to multiple providers, but rather they can tell their story to the right person at the right time. As mentioned, triage can be completed over the phone with 811, through Doorways, or by existing intake services in the RHAs. For higher intensity specialized service or inpatient treatment, some additional assessment may be required. However, for lower intensity services, the triage process is all that's needed. In the near future, Bridge the Gap will also have an option for triage. Together, these three options create better accessibility for people to connect either by phone through 811, in person at Doorways, or online by Bridge the Gap. It's important to note that primary health care providers can also continue to follow previously established intake processes in their RHAs.
Evaluation is a core component of stepped care, particularly to inform ongoing improvement of the stepped care model. It will be continuous and designed to capture change at multiple levels throughout the healthcare system, such as the organizational level, manager-director level, healthcare provider level, and patient level. Evaluation of stepped care in Newfoundland and Labrador will also be part of a larger evaluation currently being undertaken by a multidisciplinary group of researchers from across Canada, with an interest in improving the mental health care system within Atlantic Canada. As Newfoundland and Labrador's evaluation framework is developed and implemented, stakeholder consultation will inform identification and evolution of specific evaluation indicators and questions at multiple levels. Stakeholder consultation will include groups such as regional health authority leadership, MUN partners, clinicians, community partners, and people with lived and living experience. Evaluation of data will include provider and service user surveys and interviews, as well as the collection of service usage data. Key indicators will include service user and provider engagement and satisfaction with stepped care and service user outcomes with various services, including single session counseling and e-mental health. Key indicators at organizational and system level will include the number of individuals accessing care through various access points, as well as the impact of stepped care on a wait list and wait times. That brings us to the end of this presentation. To recap, we have reviewed ways people can access services and described the underlying principles and values of the stepped care service model. We also discussed the importance of having open access to a variety of types of services and of aligning treatment planning with a person's goals and readiness to engage. Please visit Bridge the Gap for all up-to-date information about mental health and addictions programs and services in our province. And with that,